All right, good afternoon, everyone, and welcome to the Nutrition and Physical Activity for Cancer Survivors Evidence and Resources, hosted by the CDOC Survivorship Work Group. So we'll go ahead and get started. My name is Joyce Parigo-Seja, Coordination Support Specialist in the California Dialogue on Cancer, or CDOC Coalition. We are giving others times to get settled in. Please feel free to type in your name, pronouns, role, and organization in the chat. So I'll go over some housekeeping while everyone's typing in your intros. All participants have been muted, but we will leave the chat open for questions. And we'll also have an allotted Q&A after the speaker's presentation. Please stay on the line until the end of the presentation to participate in the Zoom poll and complete the short webinar evaluation. So if you haven't already, welcome, and please type your name, pronouns, role, organization, and where you're joining from in the chat. California's Comprehensive Cancer Control Program is a CDC-funded program that provides leadership for and coordination of statewide comprehensive cancer control efforts. The Comp Cancer program leads the Cancer Control Coalition, the California Dialogue on Cancer, or CDOC. The program is also tasked to develop and implement a state cancer plan. And in the next slide, you can see that this is our current state cancer plan that we're currently implementing, and we are in the process of revising the next iteration of the plan. The CDOC Survivorship Work Group collaborates to implement the current state cancer plan survivorship topic areas, and specifically Chapter 9, Treatment and Survivorship of the 21-25 State Cancer Plan Objective 1 states that by 2025, increase awareness and achievement of exercise guidelines for cancer survivors set by the American College of Sports Medicine. So for example, that's 150 minutes per week of moderate intensity aerobic exercise. In regards to the Survivorship Cancer Center, work to expand, modify, and develop statewide networks to focus on survivorship, symptom management, and support families and caregivers. The purpose of including cancer centers and programs in Comp Cancer is to share best practices and resources, and also to work collectively across the cancer center network will position centers and programs to drive cancer care policy and advocacy, which is critical to ensure lasting and positive impacts on the burden of cancer across California. So I'm going to launch a poll which will appear on your screen. The purpose of this poll is to gauge your knowledge on nutrition and physical activity. So please answer the questions to the best of your ability. I'll give about 1 to 2 minutes to respond, and then I'll be sharing the correct answers at the end of the webinar. Have the polls been shared? Okay, there we go. So I'll give about a minute or so for participants to respond. Please answer to the best of your ability. I'm starting to see some responses roll in. I'll just give it a couple more seconds. Okay, thank you so much. All right. And then I'll be sharing responses towards the end. But let's go ahead and move forward. It is my pleasure to introduce to you all our guest speakers, Dr. Rusha Bhandari and Dr. Asher Arash. Dr. Bhandari is a pediatric oncologist at City of Hope and serves as the medical director of the Childhood, Adolescents, and Young Adult Survivorship Clinic. She completed her undergraduate studies at UCLA, followed by medical school at St. Louis University. She then completed a residency training in pediatrics at Washington University in St. Louis and pediatric hematology oncology fellowship at the Children's Hospital of Los Angeles. She has a master's of science in clinical biomedical and translational investigations from the University of Southern California. Dr. Bhandari has a specific interest in understanding the impacts of nutrition and body composition on cancer outcomes and the metabolic changes that occur during and following cancer-directed therapy. Dr. Bhandari is currently conducting studies on insulin resistance and muscle health in childhood and AYA cancer survivors, exercise interventions to improve fitness among survivors, and the impact of social determinants of health on outcome following treatment. Her goal is to develop a research program to mitigate adverse health outcomes, including metabolic disease in cancer survivors. Dr. Asher Arash has served as the Director of Cancer Survivorship and Rehabilitation at Cedars-Sinai Cancer since 2008, and he has a special interest in the physical and rehabilitative needs of cancer survivors who continue to experience the effects of cancer or its treatment. Dr. Asher has led the development a number of unique cancer survivorship programs with his colleagues, including Emerging from the Haze, Living with the Perceived Effects of Cancer Treatment on Cognition, or GRACE, Growing Resilience and Courage, and others with the goal of optimizing physical, psychological, and spiritual resilience for patients with cancer. Dr. Arash completed a physical medicine and rehabilitation residency at the UCLA Greater Los Angeles VA and a cancer rehabilitation fellowship at MD Anderson Cancer Center in Houston, Texas. Please join me in welcoming Dr. Bhandari and Dr. Arash. So I'll stop sharing, and Dr. Bhandari, you're welcome to share your screen.
Wonderful. Let me share those slides, and thank you for that introduction. All right. Can you all see my slides?
Yes.
Okay, perfect. So thank you for that introduction and the opportunity to speak to this group today about this important topic that we are all very passionate about. As mentioned, I am a pediatric oncologist here at City of Hope by training, and certainly some of the data that I'll present is specific to the pediatric cancer population, but really these paradigms apply across the age continuum. So with that, I'll jump in. The first few slides just wanted to sort of review sort of cancer survivorship and a broad overview of cancer survivor health needs before really jumping into the physical activity and nutrition. There we go. So this first graph that I wanted to show really shows the progress that we've made in treating childhood cancer over the past few decades. Children who were diagnosed with cancer about 60 or 70 years ago had a less than 50% chance of surviving just 5 years past their diagnosis, but now that number is over 80% of children who become long-term survivors, and the number exceeds 90% for some of our most common childhood malignancies. These survivors have many decades of life left to live after completing their treatment, and it's really our obligation to do our best to ensure that they have the best quantity and quality of life. And so I like to start with this because this paradigm of ensuring the best health-related quality of life for our survivors really, like I said, applies across the age spectrum. So when we talk about cancer treatment, some common modalities include chemotherapy, radiation, newer, more targeted immunotherapies, as well as surgery. And we often think of the short-term side effects of cancer treatment, things like nausea, fatigue, decreased appetite, hair loss. But there are many late effects from cancer treatment that can affect really essentially any organ in the body. So just some examples here include things like heart and lung disease, diabetes, neurocognitive issues, kidney disease, or muscle weakness. And we'll definitely talk a lot more about muscle in the next few slides. So really for our survivors, cancer diagnosis and treatment can be thought of as only the tip of the iceberg. They're then navigating late effects of treatment, including psychosocial and mental health needs. They're often re-engaging with their general care providers after sort of taking that detour and really having their health managed by a primary hematologist or oncologist. They're hopefully identifying a long-term survivorship care program that can provide tailored late effect screening and education. So there's a lot of different processes to navigate during the survivorship journey. So let's talk a little bit more about the need for survivorship-specific care. So this again is a graph from childhood cancer survivors, which essentially shows, if you look from the green line to the orange and then the blue line, that thankfully there has been a decrease in the burden of severe and life-threatening chronic health conditions over the past few decades among childhood cancer survivors. However, compared to the non-cancer affected siblings who are shown in the purple line here, you can see that childhood cancer survivors still have a significantly higher burden of these chronic health conditions than their siblings. And when we take a close look, what we're seeing is that at very young ages, these survivors develop conditions that we typically expect in older folks. So things like cardiovascular disease, metabolic diseases, frailty, which includes things like muscle weakness and fatigue. And this makes us think that cancer survivors experience a degree of accelerated aging. So when we talk about accelerated aging, muscle is really a great organ to study this in. So in the general population, as we all know, we expect that in childhood, the teenage years, and early adulthood, we really build our peak muscle mass and strength. And then as we age, we slowly experience a decline in our muscle health. What we expect or suspect is happening in childhood cancer survivors, because they're diagnosed and treated at young ages, at a time that their bodies are still developing, they don't reach that same peak muscle mass, and then they have an earlier and faster decline in that muscle mass. And similarly, what we suspect is occurring in survivors of adult onset cancers is maybe they're reaching the same peak muscle mass, but they're having an earlier and faster decline of that muscle. So our group has been particularly interested in understanding the implications of poor muscle health on cancer outcomes. So this is a study among adult bone marrow transplant recipients that found that following bone marrow transplant, patients had a significant decrease in their skeletal muscle mass. And this loss of muscle mass, or sarcopenia, was associated with higher risk of dying from a cause other than the primary cancer diagnosis, so non-relapse mortality following bone marrow transplant. So we were also interested in investigating the effects of low muscle mass on other important transplant outcomes, such as diabetes risk or glucose intolerance. And we found that among patients who are overweight or obese by body mass index, higher amounts of visceral fat tissue was associated with developing glucose intolerance, which isn't too surprising. It's sort of the same paradigm that we think of in the general population. But among those who are not overweight by body mass index, or BMI, it was that low muscle mass that was associated with a higher risk of developing glucose intolerance. So why am I focusing on this? Well, when we took a look, those who developed glucose intolerance within just 1 month following their bone marrow transplant had a significantly higher risk of, again, that 1 year risk of mortality due to non-relapse related causes. And so it's really highlighted to us the importance of maintaining adequate nutrition and muscle health, both during and after treatment. So after reviewing some of these potential late effects following cancer treatment, and specifically the implications of poor muscle health, I next wanted to shift to reviewing nutrition and physical activity guidelines for cancer survivors, as well as some of our studies in our survivorship program focused on improving muscle health. So I know everyone's probably very familiar with this plate, but in terms of nutritional recommendations, about half our plate really should be composed of fruits and vegetables. We should have 5 servings a day. And this is important because fruits and vegetables are important sources of fiber, which is important for both gut and cardiovascular health, vitamins, minerals, as well as antioxidants. A quarter of the plate should be grains, and preferably would be whole grains. So things like whole wheat flour instead of white flour, brown rice instead of white rice, oats. There are a variety of different grains out there. And these are important because they have fiber as well as B vitamins. And then that last quarter should be protein. There are many different protein options out there. Just a few are listed here. Things like seafood, meat, eggs, beans, lentils, nuts are something that people sometimes forget about. And we definitely recommend looking for leaner options, so things like fish or chicken breast rather than red meat. We really want to try and decrease the consumption of red meat and processed meat. Some other food items that it's recommended to sort of limit or avoid are sugar-sweetened beverages. We all know water is really the best beverage for us to be drinking. And things that we consider as energy-dense foods that are high in sugar or fat, but low in additional nutritional value. So that's sort of things like ice cream, certain desserts, certain fried foods that may have a lot of sugar or fat, but don't have a lot of those other things like fiber, vitamins, other things that we just mentioned. Alcohol is another one. In addition to red meat, alcohol has also been linked to potentially increased risk of certain types of cancer. So the recommendation is to limit alcohol consumption to 1 drink a day for women or 2 drinks a day for men, with the caveat that depending on which medications you're on or which late effects you may already have, alcohol may be off the table altogether due to either being contraindicated or having interactions with other medications that you're on. So definitely something that we recommend patients discuss with their healthcare team. And then similarly, we get a lot of questions about supplements, and at the end of the day, it's really important to discuss any new nutritional supplements with your healthcare team prior to starting. Some supplements can be really beneficial, but others can really interact with medications or affect your organs that have already experienced an insult due to the prior cancer diagnosis and treatment. So it's just important to have these conversations with your healthcare team. In terms of physical activity recommendations, as was already mentioned earlier, for adults, the recommendation is to receive at least 150 minutes a week of moderate intensity or 75 minutes of vigorous intensity physical activity per week, which can sound like a lot to people, but that boils down to about 30 minutes per day, or a TV show. So hopefully more doable when I think of it that way. For children and teens, the recommendation is at least an hour of moderate or vigorous intensity physical activity per day. And a key point here is it's really recommended to have a combination of aerobic and resistance exercises. We want that cardio, we want to get the heart rate up, but it's also important to build that muscle mass, which is what we were talking about earlier. We do often caution against heavy weightlifting for some of our patients, depending on the treatment that they've previously received, but light weightlifting with a healthy resistance exercise regimen is recommended. And in general, more is better. But there are some barriers that are unique to our survivor population that we need to consider. Oftentimes while undergoing treatment, but also after completing treatment, patients have altered taste or food aversions. Things do not taste the way they used to, or what they used to love eating, they no longer find palatable. And so it's really important to work with them to find what first works for them, but then also what within that provides the best nutrition for them. There are a variety of other treatment-related effects. This can include surgeries. For example, if patients need gastrostomy tubes to help with their feeding, then we're working on maybe a combination of oral and tube feeds for them, or maybe we're fully on tube feeds, so that's a consideration. Or if there's been a surgery that has now resulted in physical limitations and we're finding a brand new exercise regimen that works for them. Transplant recipients sometimes develop things like graft versus host disease, which can limit the amount they're able to move some of their joints, for example, or can affect even the gut, and can limit some of the foods that they're able to tolerate. And then we also do see something called avascular necrosis in our patients, which can be a result of steroid treatment. This often affects adolescents and adults more so than young children, but it can affect anyone across the age spectrum. And this can result in severe joint pain and limitations in joint movement. And so all things that we need to consider when we're trying to find a regimen that works for our survivor population. There have been a lot of different studies that have looked at survivor adherence to these nutrition and physical activity guidelines. And while these numbers aren't great in the general population, the numbers among survivors is that about 20% of survivors meet the recommended aerobic and strength training guidelines. So definitely room for improvement, and also a need for sort of innovative approaches for us to meet our survivors with, where they're at and what their specific needs are following completion of cancer treatment. That's definitely a major goal of our clinic, is to provide a tailored survivorship experience for our patients. So just briefly, our survivorship clinic was established about 20 years ago for survivors of childhood cancer. It was initially for those who were diagnosed up to the age of 22, but in recent years we've expanded to those who are diagnosed up to the age of, including the age of 39. It is a clinical research program, and we provide late effect screening per the Children's Oncology Group guidelines. And so these are evidence-based guidelines that we develop as a group. We have new guidelines that we release every 5 years. The most recent iteration was just released at the end of 2023. Like I mentioned, patients who are diagnosed up to the age of 39 are eligible to be part of our survivorship program, with the caveat that if they were diagnosed sort of in that older age range, their cancer type would be one that's common in children, since we are following the Children's Oncology Group guidelines. And this is for patients who are, of course, in remission and at least 2 years off treatment. We are open to anyone, patients who are, of course, treated at City of Hope, but also outside referrals. We have a lot of patients that come to us. Maybe they were treated at children's hospitals and they're now outside of the age range for that hospital, but we're able to follow them here. We have no upper age limit for attendance. So we have patients who range anywhere from 3 years of age to 60 or 70 in our survivorship clinic. And at our first visit, it's a really comprehensive visit. Patients see one of either our physicians or our nurse practitioners, a psychologist. As I mentioned, there's a lot of psychosocial aspects to consider and to address for our patients, and all patients meet with a dietitian. And so we really review where they are and what are some feasible changes that we can make to optimize their nutrition and exercise program. So always happy to talk more about our program if anyone has any questions about that. In addition to the survivorship clinic, we also have a variety of different studies that we have within our survivor population. So I just wanted to highlight a few that we have that are focused specifically on physical activity and muscle. So this first one was one that we just completed. It's called Determinants of Muscle Health and Prediabetes in Adult Survivors of Childhood, Adolescent, and Young Adult Cancer. And with this study, we aim to further investigate the relationship between different aspects of muscle health and prediabetes in survivors of childhood, adolescent, and young adult cancer. So we enrolled survivors both with and without prediabetes and comprehensively studied their muscle health by methods such as body composition analysis, so looking at the breakdown of muscle and fat in the body, portable muscle ultrasound. We conducted MRI to allow us to look at the muscle's response to exercise, and then also did functional tests, so things like looking at their hand grip strength, their gait speed, how, the time it took to repeatedly get up and down from a chair. And really the goal was to non-invasively study all aspects of muscle as best as we could in these longer-term survivors. This next study was conducted specifically in childhood cancer survivors, only those with prediabetes, and this was a pilot study in which all patients received a remote exercise program. We provided the exercise equipment, and it was a hybrid approach with the exercise program delivered via an online platform. So they had the first 2 sessions that were led virtually by an exercise trainer to ensure the exercises were appropriate for them and they were conducting them appropriately, they could make any modifications in the prescribed regimen if needed. And then they could complete the rest of the sessions at their convenience. And they were asked to complete 3 sessions that were 30 minutes long per week for 6 weeks. And then half of the participants were also randomized to receive a nutritional supplement called nicotinamide riboside, or NR, which is similar to a vitamin B. And again, that was every day for 6 weeks. So we recently completed both of these studies, are in the process of a data analysis and writing them up, so look forward to sharing them soon. And then this last study that I wanted to share is an ongoing one that we have in collaboration with colleagues at the Children's Hospital of Philadelphia and at St. Jude. And it's a 16-week intervention in patients who are aged 10 to 30 years old. So really during that key developmental period where they received their bone marrow transplant at a time that their bodies were still developing. They're relatively early in their survivorship journey, so anywhere from 6 months to 4 years post-transplant. And the study is aimed at evaluating the effects of remote exercise and that same NR supplement that I just mentioned on muscle strength and cardiorespiratory fitness. So there's been a lot of interest in this study, which I think is great because our patients, they do notice that their strength, their physical activity regimen, their overall fitness decline following transplant, and they're really eager to participate in this type of personalized program. And we're excited because this is something where we're enrolling patients, like I mentioned, who are early in their post-transplant period, so really trying to get ahead of these changes earlier rather than later for early detection and intervention. So we're really excited about this. In the previous studies that I mentioned, we do have a number of other ongoing studies in our cancer survivors focused on outcomes ranging from cardiac conditions to frailty to understanding the impact of social determinants of health on these and other important outcomes. And really just hope that we're able to, find regimens that work well for our patients to really help intervene early on to optimize their health for the decades of life they have left to live after their cancer treatment. With that, that brings me to the end of my slides. Just want to say thank you. We have a wonderful clinical and research team here and some great collaborators, and are of course very thankful for our patients and their families. I will stop sharing.
Thank you so much, Dr.
Asher can share his slides.
Yes. So yeah, Dr. Asher, if whenever you're ready, please feel free to share your slides. Perfect. And while he's getting situated, for any folks that have questions, please type them in the chat and we'll address them during the Q&A portion. Dr. Asher?
Okay, thank you so much, Dr. Bhandari, for that wonderful overview. I'm going to talk a little bit more about the two things. I'm a cancer rehabilitation physician, as was mentioned by training. So on my perspective on the why, much of which Dr. Bhandari already went through, so I'll be very brief in that aspect of the talk, and also clinically, so outside of research, how we do the how. And so why is exercise important for optimal survivorship? Again, Dr. Bhandari went through much of this. This was from the Institute of Medicine from a number of years ago, but I don't think the issues have changed much in terms of what types of concerns our cancer survivors may experience, from physical issues like lymphedema, osteoporosis, joint pains, cardiorespiratory effects, to psychological and psychosocial issues. And again, I know I'm biased because I'm a rehab clinician by training, but in my estimation, the vast majority of these issues, and I kind of highlighted the ones that spoke to me in red, can be at least mitigated with exercise. Right, so all of these things, that we don't have pills to resolve much of the things that we have to contend with, but on some level, I believe that exercise can at least improve many of the things that our cancer survivors may have to contend with. And as Dr. Bhandari mentioned, exercise truly is medicine. When I was first in medical school, I still remember we really just talked about muscle and how the fibers connect and its utility for lifting things, for allowing us to stand and walk and to complete mechanical actions. Of course, over the last 10 years or so, we've learned that muscle seems to be its own endocrine organ. So it also does something. So when somebody does a squat or a pull-up or walks and they contract their muscle, it's not just that's allowing us to move, but it produces its own set of chemicals. Some of these have been dubbed myokines, which then reduce inflammations. Many of these compounds seem to have anti-tumor effects, at least for some tumor types. And for, a lot of my practice tends to be breast cancer survivorship. We know, that it seems that all-cause mortality is reduced almost by half for people that get the amounts of exercise that was discussed, about 150 minutes or more per week. Based on one study, another study suggested 40% reduction in breast cancer specific mortality. And so this is important for not just, again, breast cancer specific mortality, but we have to recall, as was mentioned by Dr. Bhandari, many of our survivors have to worry about cardiovascular disease. And again, this is one intervention that can potentially improve both outcomes. This was another meta-analysis study from a number of years ago that looked at VO2 max. So looking at our fitness level, and correlating that with mortality among both men and women and different cancer types. And again, if we draw your attention to the end, all-cause mortality, if you had high cardiorespiratory fitness, CRF, compared to low, seemed to reduce by almost in half, which again, to me, is quite remarkable. I think for those of you that work with patients, if you have not already seen this, I think it's a useful handout to have available. This is from the American College of Sports Medicine, where they basically highlighted in a one-page flyer the level of evidence, and they suggested that there was strong level of evidence for exercise, either aerobic or resistance, or a combination for things like cancer fatigue, anxiety, depression, lymphedema. And they kind of highlighted, based on each of these conditions, how much aerobic and how much resistance the evidence seems to support. So I think it's a useful flyer just to have for many of our patients. But again, the bottom line is cancer survivors, as was mentioned multiple times, should get 150 minutes of moderate or 75 minutes of vigorous, and at least strength training twice a week. And again, this is generally associated with anywhere from a 30 to 50% reduction in all-cause mortality, at least for a number of cancer types. So all this said, the challenge is how many of our patients are actually getting there. And Dr. Bhandari mentioned 20% based on some studies. This just came out from JAMA Oncology not too long ago, where they looked at 10,000 patients who had completed their treatment. So they looked at 4 factors, though. Are you getting the right amount of activity? Is your weight in the right range? Alcohol use and fruit and veggie intake. And only 4% in this sample were fully adherent to all 4 domains. So that means, right, we have a tremendous opportunity to make a difference. Interestingly, they found that 70% of the sample met physical activity, which I was surprised at. Again, many other studies suggested 20 to 30%, 15 to 30%, somewhere in that range. So we have our work cut out for us. So clinically, you know, when I see our patients, and again, this is just my clinical sense, many of our patients fall into 1 of 3 buckets. There are some that you don't have to do anything. They're going to go back to exercising and yoga and weight training and all the things that you know, they should be doing, maybe with a little nudge, but they're really self-motivated, and they're going to get back to that level of exercise rather easily because of their previous habits and motivation and conscientiousness and whatnot. And then there's another group that no matter what you may offer, the reality is they're just not inclined to get moving for whatever physical or psychological barriers that may exist. But I would argue clinically that the largest cohort is somewhere in the middle, where they're not already achieving the right amount of exercise, but they are willing, if they are provided the infrastructure, right? If somebody can guide them, instruct them, and help them learn how they can safely start an exercise program and evolve it over time, that they would be willing if the mechanisms at play were in place. And so because of that sense that I thought many of our patients fell into that middle bucket, a number of years ago, we created what we call our Cancer Exercise Recovery Program, where this is a 3-month program where we individually tailor an intervention based on their fitness level at baseline, their strength at baseline, their balance, their flexibility, some personal factors based on what their platelets might be and their laboratory manners, if they have bone metastases or not. We kind of take that together and create an individualized prescription that is then gradually progressed over these 3 months. And the hope is that when you do this 2 to 3 times a week for 3 months, right, you have the momentum and the inertia to keep going at the park, at the YMCA, at the gym, at home, on your own after this is completed. And I could tell you we've had about 85–90% attendance rates. So it's really, and we have like a 1-year wait list. This is a picture of our what we call our wellness gym. And so a couple of years ago, we did a kind of a quality research study to look at why. Like, how is it that people were willing to fight the traffic of Los Angeles where we're located and the parking hassles and whatnot, and come 90% of the time or more to this 3-month exercise program. And this was done in collaboration with my colleagues, including Dr. Selena Shirazapur, who really led this project. And there were a couple of themes that really stood out. Number one was social support. And again, it kind of almost becomes like a support group, because remember, this gym is not for cardiac patients or just a general public or what. This is meant for our population entirely. So, you know, if you have body image concern changes and hair loss or other things, you feel kind of safe in this environment, and our trainers understand the concerns that our survivors go through. So I think that social support in this QI equality kind of qualitative research project shown to be important. The individual tailing was another factor. So again, they're not in a group class with 20 people and they're trying to keep up with the next person. It's really tailored to their fitness level and allowing our participants to identify their goals and our team enabling them to achieve these goals in a way that's challenging but yet achievable. And third, you know, we don't charge for this, so that we're just reducing another barrier, and there's flexibility in the scheduling, and that we believe was another factor that allowed for some of the success of the program. And what we've learned, again, from this case series, is that patients reported that they had improvements in all of these areas, that they had a sense of self-confidence, you know, their physical, mental health improved. They had a better acceptance of their body after cancer treatment, and their sense of self-efficacy improved. And, you know, that was kind of hard for me to understand, but when you come in and you can't do like 3 squats and you leave, you're able to do 20. That sense of mastery isn't only relevant to how many squats I feel like I can do, but that confidence then seems to translate to other areas of life as well. So that's our clinical program, our cancer exercise recovery program. I briefly just want to highlight this idea of nature for exercise. And I could personally tell you I've been on a quest to get to all 61 national parks in the country before my kids graduate college. I think we've done, what, 36 right now. And I can tell you that when I'm kind of walking in a green oasis filled with trees or a river or a stream or whatnot and plants, compared to walking like in a busy urban area in LA, I personally never feel the same. And of course, when you dive into this, there's been a fair amount of research in non-cancer populations that the wear is important. And it seems that, again, in non-cancer populations, that being in green spaces supports how our brains are working, and it reduces inflammation and associated with better sleep and depression and anxiety. But again, we knew that there was very little research done among cancer survivors. So again, I've had the great fortune to partner with Dr. Selena Shirazapur, and we recently completed a pilot study. We're still in data analysis, really just doing a pilot looking at the feasibility of having breast cancer survivors come out to a green nature preserve 3 times a week for 3 months. And if they're able to actually stick with this kind of intervention, again, the primary endpoints was attendance and retention. And secondary endpoints, we want to look at, and again, there was no control group for this pilot study. How does this impact our well-being from a number of questionnaires that we had them completing? We also measured their blood to look at markers of aging, markers of inflammation. So very simply, we did our baseline assessments in the hospital. This is where we did the study. This was a place called Franklin Canyon, which it's hard to believe, in the middle of Los Angeles, you could actually find a place where there are essentially no cars and you really feel like you're in an oasis. And then again, at the end of the study, we completed the same assessments. So the assessments included, again, the basics with the vitals, 6-minute walk test, grip strength, leg press. And again, we drew blood to look at some of the biomarkers that we think were important, and along with some of the well-being surveys, things like the Promise 29, FACT-G, and post-traumatic growth inventory. So the data is being analyzed. We already have some preliminary data for the well-being, which showed that, not surprisingly, there were improvements. Our colleagues with Steve Cole's team at UCLA is analyzing the blood, hopefully soon. And we're really utilizing this pilot data to do what we hope is the study that we really had in our mind, which is we just submitted an R1. We'll see if it gets funded, where we plan to randomize our cancer survivors to 2 groups. So the plan is to keep the frequency of exercise, the type of exercise, the intensity, the duration, all identical. The only thing we're going to change is you would get randomized to our gym, to be on treadmill, versus a green oasis, so to speak, to really see if the location, the where, makes any difference in how we feel and also how our biology may change. So we hope we're able to complete that study. And again, my gratitude to Dr. Sarazapour and Jessica, and many members on our team for really pushing the study forward. And again, I thank you all for your attention. And if there's time, I think we'd both be happy to take any questions or comments. Thank you.
Thank you so much, Dr. Asher and Dr. Bhandari. I'm just quickly going to share my screen really quick to introduce our Q&A facilitator. Our Q&A facilitator is Natalie Ledesma. She is the Senior Oncology Dietitian of the UCSF Helen Diller Family Comprehensive Cancer Center, and she will help kind of facilitate any of the questions. Feel free to come off of mute, and I will stop sharing my screen. So Natalie, please take it away.
Thank you both. Thank you all for attending and for sharing your wisdom. And just adding to Dr. Asher's words, I think one area that I found to be so pivotal with nutrition and physical activity the past 25 plus years is that it is a very empowering tool for a patient. And that empowerment is priceless. I think it provides so much more in terms of your thoughts, in terms of the self-efficacy and these different components. It's not just the nuances and the specifics of exactly what they are doing, but it's the fact that they have some control over these different aspects of life. And I think that cannot be kind of overrated. So I think that's an important piece. From Jose, I think this is directed at Dr. Asher. From the 4% that are adherent, is there any information from there in terms of how they are successfully motivated? I think you touched on this right after this question probably came in. And then what could all cancer survivors learn from that 4%? Or maybe it's how do we help educate those other 96% to help increase that 4% a little bit or a lot, higher?
Great question. From the study, they didn't go into those nuances. It was a cross-sectional survey. It was self-report. So that type of nuance in terms of the psychological motivations were not available. But I think we should discuss and see, what we can glean and learn from that 4%. What is it about them? And again, I think one of the things I always ask my patients when I see them in clinic, and again, I normally see them after their surgery, chemo, radiation, et cetera, is done. The first question I often ask is how they were doing before they were ever diagnosed, because it often predicts, right, what kind of trajectory we anticipate. And I think if we can focus our attentions on the individuals that had some challenges before, maybe they had fibromyalgia or depression or anxiety or insomnia prior to their diagnosis, those are the ones I think we should be, focusing our healthcare dollars and resources on. Because the people, and again, I don't want to be glib about this, the people that were doing really well prior, most likely with some guidance and maybe, a few words of encouragement, I think they usually do pretty well. But there's a large majority that had these comorbidities and challenges with chronic migraines and back pain and fibromyalgia. Those are the ones I think we should be focusing on, in my opinion, offering programs like our cancer exercise recovery program or yoga or whatever makes sense for our local environment because community, I think, is a big part of it. That, when we role model from others, right? So one of the things with our program that we learned is when they see that, Mrs. Jones can also, she had a similar diagnosis and look, she's doing it, then there's this idea that I can role model from her as well. But I'd be open to, of course, any other ideas and insights from others.
Fantastic. And I would add too, I think for some of those patients who perhaps weren't doing so well prior, it's partly just kind of getting their foot in the door, and then working. And I think not expecting that they're going to go from how they are feeling and basically that not feeling well to doing a 90-minute yoga session or a 60-minute, gym session, but maybe it literally is starting with a 5-minute, walk around their kitchen table, or some resistance bands or something that some others may be like, oh, that doesn't count, but it's better than 0 minutes. And then gradually building that up so that over time they are doing a more substantial amount, but every little bit is going to help their energy, their appetite, their desire to want to, really nourish their bodies and heal and, eat well. And so I think all of these different components will compound on one another, hopefully in more of a positive, progressive fashion. So lovely. Dr. Bhandari, I smiled when you noted to, please discuss supplement use with medical team. I really do find that being open and to learn and discuss is crucial. And I think sometimes we, as healthcare practitioners, if we're not experts in one area, may have a tendency to be like, oh, nope, just don't do it. And what happens, I find, is then patients just simply don't tell us what they're doing. And that actually, of course, can potentially lead them to a much more dangerous, path. So just simply being open. And if we don't know the answer, we can always learn and research to determine that. One thing you noted were the survivors kind of having this accelerated aging component. I was curious if you've had much thought or research into the look of kind of how cancer may impact our mitochondria, and if we're able to kind of really, focus on, supporting our mitochondrial health, perhaps by assessing and then doing that, if you've seen that being able to not necessarily reverse aging, but to kind of at least help support the patients along the path.
Such a great question. And for one of the studies that I mentioned, actually, our pilot study where we did exercise for everyone and then the nicotinamide riboside for half the patients who are randomized to receive it, we're actually looking at metabolomics. Those are all in process right now, actually, so hope to have more to share on that soon. But that's exactly it. We're looking at the mitochondria. That's also the functional imaging that I briefly alluded to is we're actually non-invasively using MRI to look at how quickly the muscles sort of recover after an exercise stimulus, sort of as a marker of mitochondrial health. And we did this again both before and after the exercise intervention. So we are really interested in looking at mitochondria in as non-invasively of a manner as possible. But I think there's a lot to learn there in terms of how they're affected by the cancer treatment, as well as these sequelae like physical inactivity, things like that.
Yeah, I'll be interested to kind of see as the research develops, in that area. So
Yeah.
one question came in. Do either or both of you have any resources for nutrition and or physical activity that are available in other languages, in particular Chinese or Spanish?
Go ahead.
I was just gonna call upon one of my, I think he was here, Jose Gomez, who was at Cedars-Sinai, and unfortunately we lost him to City of Hope. He's been my go-to person for finding some of these resources in other language. I don't know if Jose is able to unmute and share anything, but Dr. Bhandari, I don't know if you have other thoughts.
Yes, Jose, go ahead, and then I can add on to that.
Oh,
yeah, I'm happy to help with offering resource language support. So yes, thank you, Dr. Asher, for the shout. I appreciate it. Sorry, I'm not sure if you heard that.
I think we could hear it. It was a little bit muffled, but I think we got it. You have resources you are willing to help.
Yes, yes,
Any
appreciate it.
that you want, just so many that it's difficult to kind of make a note of that, I'm guessing. Is there, if there's a link or a site or something, some way that people could reach out to you, or that at least that they should reach out
Yeah,
to
it
that?
really depends on the organization and what kind of, funding support you have for language resources. But I'm happy to chat. I can put my email in the chat.
Thank you, Jose. Much appreciated.
And I'm also happy to afterwards send a link. We just finished making a new series of educational videos for our survivorship website that are both English and also with Spanish subtitles. So once those are posted, I'm more than happy to share that link too. One of the videos is on healthy lifestyle, including nutrition and physical activity. And I believe the Leukemia Lymphoma Society, they definitely have nutritional support regardless of cancer diagnosis. And I want to say they have support in Spanish in terms of connecting you with a nutritionist or dietitian, but I have to check on that. But they offer some free support and counseling or consultation.
Fantastic. Well, thank you both for, again, your words of wisdom and the questions that came through as well. I'm going to pass it, I think, back over to Sheila to do a Zoom poll and also a couple other announcements.
Wonderful. Thank you so much for the rich Q&A. So I will be, or Sheila will be relaunching the poll to measure knowledge gain during this webinar, which will appear on your screen shortly. Please take some time to answer the best of your ability. I'll give about 1 to 2 minutes to respond. Wonderful. Thank you so much, everybody. So we're going to go ahead and end the poll, and we'll share the responses, and then I'll also share the answers, just for your knowledge. But just as a kind of PSC, please post in the Zoom chat one thing that you learned from today's webinar that you aim to implement in your organization. You'll also have an opportunity to share your implementation goals in the evaluation survey, which will be dropped in the chat. And just to close off, I have a couple of reminders for our upcoming webinars. If you have not already, please register for the Cancer Plan Development Instructional Webinar on Tuesday, June 22nd from 12 to 1. As I mentioned, we are currently in the process of creating our next iteration for our state cancer plan. Lastly, the CDOC Survivorship Surveillance webinar series, the CCR or California Cancer Registry will present on advanced stage breast cancer among women 40 years and older on medical service study area in California from 2016 to 2020. And this is happening on June 27th. And all links will be dropped in the chat. And thank you so much, everybody. I hope you have a great rest of your day. Take care.